Seeing blood in your urine, yeah, that's one of those things that can be pretty scary, right? It sends a lot of people, and for very good reason, straight to their doctor. But what does it actually mean? Well, it's way more common than you might think, and the reasons behind it are often, well, misunderstood. So we're gonna break down what's really going on. So what is really happening when you see this? Is it automatically a sign of something awful? That's the million-dollar question, isn't it? We're gonna dive into what doctors are looking for, how they find it, and most importantly, what the results actually mean for your health.
All right, let's start at the beginning. First up, the proper medical term for this, and a really crucial distinction that you need to get your head around right from the start. Okay, so the official term is hematuria. And here's the number one thing to remember. It's a symptom, not a disease in itself. I want you to think of it like the check engine light in your car. The light isn't the problem, right? It's just a signal, a little warning sign telling you it's time to pop the hood and see what's going on. Now, hematuria basically comes in two flavors. First, you've got visible hematuria, or VH. This is the one you just can't miss. Your urine might look pink, red, or sometimes even dark, like cola. Then there's non-visible hematuria, or NVH. And with this one, you'd have no idea it's there. It can only be picked up by a lab test, like a simple dipstick. And that's a huge takeaway. You can have blood in your urine without ever seeing a thing. So let's talk about that second type, the non-visible kind. I mean, how do doctors find something you can't even see? Well, it all starts with a simple but surprisingly clever little tool. And here it is, the dipstick. This is usually the first line of detection, and it's incredibly sensitive. We're talking sensitive enough to pick up on just 1 or 2 red blood cells in a sample. It's that power that makes it such an amazing screening tool. So how on earth does it work? It's actually a pretty neat bit of chemistry. The stick isn't looking for whole red blood cells. Instead, it's designed to detect a component called heme, which is found in blood. If heme is there, it kicks off a chemical reaction that turns a little pad on the stick blue. And as you can see here, a result of 1+ or more is what doctors consider significant. A trace result, that's seen as negative. But, as great as it is, the dipstick isn't perfect. Because it reacts to heme, it can sometimes be set off by things that aren't blood, like muscle breakdown after a really intense workout. That's what we call a false positive. And on the flip side, though it's pretty rare, a huge dose of vitamin C can sometimes block the reaction and cause a false negative.
So, this brings us to the really big question. If you get a positive result, what does it actually mean? Just how concerned should you be? Let's put this all into perspective. Okay, get ready for this number. A long-term study looked at healthy male soldiers, and it found that a staggering 40% of them had microscopic hematuria at least once over a 12-year period. 40%! That just goes to show you it can be a totally temporary thing, often triggered by something as simple as heavy exercise. And this chart really tells the story for most people with that non-visible hematuria. Even after a full, complete medical workup, in about 70% of cases, doctors find absolutely no specific underlying disease. The check engine light was on, but it turned out there was no serious problem to fix. That's pretty reassuring. So, when do doctors decide it's time to investigate further? Well, they follow some pretty clear guidelines. As you can see, if the blood is visible even once, that's always considered significant. If it's non-visible but comes with other symptoms like pain, that's significant too. And finally, if it's non-visible, you feel fine, but it keeps showing up, like on 2 out of 3 tests, that also warrants a closer look. Okay, so let's say your situation checks one of those boxes and is considered significant. What happens next? Let's walk through what the investigation process usually looks like. The reason for such a thorough investigation is that hematuria can be a symptom of a really wide range of things. It could be something pretty straightforward, like a simple infection, kidney stones, or in men, an enlarged prostate. But it can also be a sign of inflammation, other kidney issues, or in some cases, cancer. The whole point is to rule out the serious possibilities and find the root cause. And this is exactly why that difference between visible and non-visible hematuria is so important. Just look at this chart. The risk of a urological cancer being the cause is way higher when the blood is visible. We're talking around 20 to 25%. Compare that to only 5 to 10% for non-visible cases. This is a massive piece of the puzzle that helps doctors decide what to do next. A modern workup isn't some big mystery. It follows a really clear step-by-step process. It usually starts with urine and blood tests to check for things like infection and to see how well your kidneys are working. After that comes imaging, often a CT scan, to get a super detailed picture of your entire urinary system. And finally, there's a procedure called a cystoscopy, which uses a tiny camera to look directly inside your bladder.
So the tests are done, the results are in, and for a whole lot of people, they all come back negative. Great news. But what happens then? Is it just case closed?
Well, let's look at a pretty common scenario. Say you're under 40, you have no other symptoms, and that initial big investigation found nothing wrong. The modern approach isn't to just forget it. It's to shift into a monitoring phase. As this table shows, that usually just means yearly checks on your kidney function, blood pressure, and for protein in your urine. A full reinvestigation is only really needed if something new pops up, like if the hematuria suddenly becomes visible.
And this brings us to a really important finding from modern research. If that first really thorough investigation comes back clean, repeating the whole thing over and over again just because the non-visible hematuria is still there is very, very unlikely to find anything new. The diagnostic yield, as doctors call it, is just extremely low.
So what's the bottom line in all of this? Well, it's this. While hematuria should always be investigated properly the first time, a negative result is incredibly reassuring. Studies have followed patients for over a decade and found that if that initial workup is clear, the risk of a missed cancer popping up later is virtually zero. And that leads to a powerful conclusion. What really matters is paying attention to new changes, not retesting the same old signal. And hopefully that gives you a much clearer picture of what it really means to see blood in your urine.